A CNA notices that a resident with dementia is repeatedly trying to leave the facility, stating they must go home to feed the children. What is the most appropriate response? A. Remind the resident they no longer have children at home. B. Restrain the resident to prevent wandering. C. Redirect the resident with an engaging activity or gentle conversation. D. Call the physician immediately. Answer: C. Dementia care requires validation and redirection, not confrontation. Telling the resident their belief is wrong may increase agitation. Restraints should only be used as a last resort and require orders. The CNA should gently redirect by engaging the resident in a safe activity, which reduces wandering behavior and preserves dignity. While assisting a resident with a stroke who has right-sided weakness, the CNA should: A. Dress the weak side first, undress the strong side first. B. Dress the strong side first, undress the weak side first. C. Always start with the left side regardless of weakness. D. Ask another CNA to complete dressing. Answer: A. When dressing residents with hemiparesis, always dress the weak side first because it is harder to move. When undressing, remove clothing from the strong side first. This method prevents injury, conserves energy, and maintains resident comfort and independence. A resident who is NPO is observed sipping water from another resident's cup. The CNA's first action should be: A. Inform the charge nurse immediately. B. Remove the water and monitor for signs of aspiration. C. Ask the resident why they are drinking. D. Continue observing silently to avoid alarming them. Answer: B. NPO means nothing by mouth, usually due to medical conditions or pending tests. If a CNA sees a resident drink water against orders, the water should be removed immediately, and the CNA should observe for aspiration or distress while notifying the nurse right after. This prevents complications like choking or aspiration pneumonia. A resident who recently lost their spouse refuses meals and states, "I don't see a reason to live anymore." What should the CNA do first? A. Offer to bring a favorite dessert. B. Encourage the resident to join a group activity. C. Report the statement to the nurse immediately. D. Reassure the resident that everything will be fine. Answer: C. Expressions of hopelessness or suicidal thoughts must be treated as serious risks. The CNA's duty is to report immediately to the nurse for proper mental health intervention. Comfort and encouragement may help later, but the first priority is safety and reporting. During morning care, a resident becomes combative and starts hitting the CNA. The best action is to: A. Continue care quickly to finish faster. B. Step back, ensure safety, and give the resident space. C. Yell at the resident to stop immediately. D. Hold the resident's arms down until they calm. Answer: B. Safety comes first. The CNA should step back, protect themselves and the resident, and allow space. Combative behavior may be due to confusion, pain, or fear. Restraints or force should not be used unless absolutely necessary and authorized. Afterward, report the incident. A CNA is emptying a resident's urinary drainage bag and notices cloudy urine with a strong odor. What should the CNA do? A. Discard the urine without documenting. B. Report the observation to the nurse immediately. C. Add more water to dilute the urine before measuring. D. Ignore since odor can vary. Answer: B. Cloudy urine with odor may indicate a urinary tract infection, UTI. The CNA cannot diagnose but must report changes promptly. Accurate reporting helps ensure early treatment and prevents complications such as sepsis or kidney damage. When assisting a resident with dysphagia, the CNA should: A. Offer thin liquids with a straw. B. Position the resident upright at 90 degrees during meals. C. Allow the resident to eat quickly to finish faster. D. Place food at the back of the throat. Answer: B. Dysphagia, difficulty swallowing, requires safety measures to prevent aspiration. Upright positioning is critical for safe swallowing. Thin liquids with straws increase aspiration risk. The CNA should encourage slow eating, small bites, and proper posture during and after meals. A resident begins choking while eating but is still able to cough forcefully. What is the best CNA action? A. Immediately perform abdominal thrusts. B. Encourage the resident to continue coughing. C. Hit the resident's back repeatedly. D. Leave and call for help only. Answer, B. If the resident can still cough forcefully, the airway is partially open. Encourage continued coughing until the object clears. Abdominal thrusts are only for complete airway obstruction when the person cannot speak, cough, or breathe. A CNA finds a resident on the floor, alert but complaining of hip pain. What should the CNA do first? A. Help the resident back into bed immediately. B. Assess for fractures by moving the leg. C. Call for help and stay with the resident. D. Give the resident water to calm them. Answer, C. Safety is priority. The CNA should not move the resident because hip fractures are common after falls. Instead, stay with the resident, call for help, and report to the nurse immediately. Moving could worsen the injury. A resident refuses to take a shower on their assigned bath day. The CNA should A. Force the resident to shower to maintain hygiene. B. Respect the resident's choice and offer alternatives like a sponge bath. C. Skip hygiene entirely until the next scheduled bath. D. Threaten to report the resident if they don't comply. Answer, B. Residents have the right to refuse care, including showers. The CNA should respect this decision and offer alternatives, ensuring dignity and hygiene. Coercion or threats violate residents' rights and can cause psychological harm. A resident with advanced dementia keeps removing their oxygen cannula. What should the CNA do first? A. Apply wrist restraints to keep the cannula in place. B. Notify the nurse and stay with the resident to ensure safety. C. Ignore the behavior since it is common in dementia. D. Tape the cannula tightly to the resident's face. Answer, B. The CNA must never restrain or ignore unsafe behaviors. Taping equipment is unsafe and violates dignity. The correct action is to stay with the resident and notify the nurse immediately, ensuring safety while the nurse decides on an appropriate intervention such as alternative oxygen delivery methods. A CNA notices that a resident with a feeding tube is coughing and choking during a feeding. What is the priority action? A. Stop the feeding immediately and notify the nurse. B. Give the resident water to help swallow. C. Raise the feeding rate to flush the tube. D. Wait a few minutes to see if coughing stops. Answer, A. Coughing during tube feeding may signal aspiration or tube misplacement, which is a medical emergency. The CNA must stop the feeding right away, keep the resident upright, and notify the nurse. Giving water or increasing the rate could worsen aspiration and harm the resident. When assisting a resident with Parkinson's disease, which action best promotes independence in eating? A. Feeding the resident completely to save time. B. Encouraging use of weighted utensils. C. Offering only finger foods. D. Asking the resident to fast until family arrives. Answer, B. Weighted utensils help reduce tremors and allow residents with Parkinson's to feed themselves more effectively. Complete feeding by staff reduces independence, and restricting foods is inappropriate. Promoting independence supports dignity and rehabilitation goals. A CNA enters a room and finds a resident lying on the floor. What should the CNA do first? A. Help the resident back into bed immediately. B. Check the resident for consciousness and breathing. C. Call housekeeping to clean the area. D. Scold the resident for getting out of bed alone. Answer, B. The first priority is safety and assessment. The CNA should not move the resident until they know if there are injuries. Checking consciousness and breathing determines if CPR or emergency services are needed. Reporting to the nurse follows assessment. Which task is outside the scope of practice for a CNA? A. Reporting changes in skin condition to the nurse. B. Assisting residents with ambulation. C. Administering medications through a feeding tube. D. Taking and recording vital signs. Answer, C. CNAs are not trained or legally permitted to administer medications, including through feeding tubes. Their role includes assisting with daily care, observing changes, and reporting to the nurse. Medication administration is a nurse's responsibility. A CNA hears a resident making suicidal statements. What is the best immediate action? A. Stay with the resident and report to the nurse right away. B. Ignore the comment since residents often complain. C. Tell the resident to stop talking negatively. D. Call the family without informing the nurse. Answer, A. Suicidal statements must always be taken seriously. The CNA should stay with the resident for safety and immediately inform the nurse. Ignoring or dismissing the statements could put the resident at risk. Only the nurse or care team should decide on family notification. When caring for a resident with a hearing aid, the CNA notices the resident still cannot hear. What should the CNA check first? A. Whether the device is turned on and has working batteries. B. If the resident is faking hearing loss. C. Whether the resident's ear canal is completely clear. D. If the resident needs a stronger prescription. Answer, A. The most common cause of malfunction is the device being off or batteries not working. CNAs can check these basic issues. Diagnosing medical or prescription needs is outside their role. If problems persist, the nurse or audiologist should be informed. A resident with congestive heart failure is on strict fluid restrictions. The CNA sees the resident's family giving them a large glass of juice. What should the CNA do? A. Take the juice away and scold the family. B. Allow the family to continue since they are visitors. C. Politely remind the family of restrictions and report to the nurse. D. Hide the juice and give it later when no one is watching. Answer, C. Fluid restriction is a medical order for the resident's safety. The CNA should respectfully remind the family, support compliance, and report to the nurse. Scolding or hiding food undermines trust and is unprofessional. A CNA is asked to collect a urine specimen from a resident who is incontinent. Which method is most appropriate? A. Use a bedpan and transfer urine into a specimen cup. B. Place a clean catch bag designed for incontinent patients. C. Wring out wet incontinence pads into a cup. D. Skip the collection and document the difficulty. Answer, B. Special collection bags are available for incontinent patients. Bedpan urine may be contaminated, wringing pads is unhygienic, and skipping tasks is neglect. Correct specimen collection ensures accurate test results. When should hand hygiene be performed during perineal care? A. Only after completing the entire care task. B. Before care, after removing gloves, and whenever contaminated. C. Once per shift regardless of tasks. D. Only after leaving the resident's room. Answer, B. Perineal care involves high risk of contamination. CNAs must wash hands before care, after glove removal, and any time contact with body fluids occurs. Proper hand hygiene prevents infections and protects both resident and staff. Which approach is best when communicating with a resident who has moderate aphasia after a stroke? A. Speak loudly and rapidly so they can keep up. B. Use simple phrases, gestures, and allow extra time for responses. C. Ignore attempts at speech and do tasks silently. D. Insist the resident writes everything down. Answer, B. Aphasia affects speech comprehension and production. The best approach is patience, simple communication, gestures, and extra time. Speaking loudly or rushing increases frustration. Writing may not be possible for all residents post-stroke. A CNA is assigned to a resident who is Muslim and fasting for Ramadan. How should the CNA best respect their care? A. Encourage the resident to eat during regular meal hours. B. Save meals for after sundown if allowed by facility policy. C. Refuse to accommodate religious practices. D. Secretly offer snacks to avoid hunger. Answer, B. Respecting cultural and religious practices is part of holistic care. Saving meals for after sundown aligns with the residents' beliefs while still meeting nutritional needs. CNAs should always follow facility policy and report to dietary staff if adjustments are needed. A resident becomes combative during a bath and tries to hit the CNA. What is the most appropriate first response? A. Hold the resident down to finish the bath quickly. B. Step back to ensure safety and speak calmly. C. Call security to restrain the resident immediately. D. Ignore the behavior and continue bathing. Answer, B. Safety comes first. The CNA should step back to avoid injury and use a calm, reassuring voice to de-escalate. Forcing or ignoring aggression may escalate behavior. If aggression continues, the CNA should stop care and notify the nurse. Which statement shows correct understanding of pressure injury prevention? A. Position changes every 4 to 6 hours are sufficient. B. A resident who can shift weight does not need reminders. C. Using pillows and repositioning every 2 hours helps prevent injuries. D. Pressure injuries cannot be prevented in bedbound residents. Answer, C. Repositioning every 2 hours and using supportive devices are key preventive measures. Even residents who can move may need reminders. Pressure injuries are preventable with consistent care. A CNA hears the fire alarm while with a resident. What is the first action? A. Immediately evacuate all residents from the building alone. B. Rescue the resident in immediate danger and close doors. C. Run to the alarm panel to check location. D. Ignore the alarm until an announcement is made. Answer, B. Fire safety follows race, rescue, alarm, contain, extinguish. The CNA must first rescue anyone in immediate danger and close doors to contain fire and smoke. Only then should the alarm and evacuation procedures continue. A resident tells the CNA they feel dizzy when standing. What should the CNA do first? A. Encourage the resident to walk through the dizziness. B. Assist the resident to sit or lie down immediately. C. Ignore the complaint and continue care. D. Give the resident a glass of cold water. Answer, B. Dizziness can indicate orthostatic hypotension, risk of fainting, or other medical issues. The CNA should immediately ensure the resident's safety by helping them sit or lie down, then report to the nurse. Ignoring or pushing activity risks falls. A CNA notices a resident with diabetes has not finished their meal and appears shaky. What is the priority? A. Offer a snack with sugar and report to the nurse. B. Ignore it because residents sometimes eat less. C. Take the tray away to prevent overeating. D. Wait until the next scheduled meal. Answer, A. Shakiness in a diabetic resident may indicate hypoglycemia. Immediate intervention with a quick source of sugar and notifying the nurse is necessary. Ignoring symptoms could lead to serious complications like loss of consciousness. Which observation requires the CNA to notify the nurse immediately? A. A resident refusing to attend activities. B. A resident with new slurred speech and facial drooping. C. A resident who is sleeping during the afternoon. D. A resident with mild bruising from bumping into furniture. Answer, B. Sudden slurred speech and facial drooping may indicate a stroke, a medical emergency requiring immediate attention. Refusal of activities, napping, or minor bruising are important but not emergencies. A CNA notices that a resident's care plan specifies contact precautions. What action is required? A. Wear gloves and gown when entering the room. B. Only wash hands after leaving the building. C. Avoid providing any physical care. D. Use no protective equipment unless the resident is coughing. Answer, A. Contact precautions are used for infections spread by direct or indirect contact. The CNA must wear gloves and gown when entering and remove them properly after leaving. This prevents cross-contamination and protects others. A CNA must collect a sputum specimen from a resident. What is the best method? A. Ask the resident to cough deeply into a sterile container. B. Collect saliva from the mouth after meals. C. Scoop mucus from a tissue after the resident sneezes. D. Have the resident spit directly into the CNA's gloved hand. Answer: A. A sputum specimen must come from the lungs, not saliva or nasal mucus. The resident should be instructed to cough deeply into a sterile container. This ensures accurate results for diagnosing respiratory conditions.